Hello, everyone. We are going to introduce our book, Quality in Healthcare, a Lean Six Sigma Project Approach. I am Karuppan, Professor Emerita of Operations Management with an emphasis in process management and operations strategy. I've been teaching the quality course at Missouri State University since the inception of the DMAIC program in 2006. Our colleague, Dr. Dunlap, could not join us today. She's Professor Emerita of Medicine at the University of Alabama. She's a retired physician and leader. Throughout her career, she has worked incessantly to increase the quality of healthcare outcomes.
And my name is Dr. Rob Cavagnol. I'm a general surgeon by training, and I've held numerous leadership roles at various healthcare institutions. We are really excited about this opportunity to share with you some details, a little bit of the behind the scenes look into our book, Quality Management in Healthcare, a Lean Six Sigma Project Approach. Our intent was to make the material directly applicable to the healthcare environment. It's indeed a very hands-on and follows the Six Sigma define, measure, analyze, improve, control framework.
What is unique about this book is that it engages the learners into a complete process improvement project with the development of an A3 report. Here's a completed A3 report. How do we do this? Well, we used an interactive running case. Here's an example. In each chapter, we have multiple inserts describing various aspects and stages of a process improvement project that is conducted at a fictitious organization, Bright Angel Medical Center. In those, we try to link leadership to practice. We present various tools, and we have a couple of questions that are amenable to discussion or reflection. This approach enabled us to connect process waste reduction with zero defects and higher value. It also allowed us to demonstrate how those Lean Six Sigma tools can help describe, evaluate, and improve a process. In each chapter, we show how these tools are used in the real world through a series of interviews of healthcare professionals.
So how do we do that? I incorporated numerous leadership lessons that I've learned throughout my career as a physician executive. We also have tutorial videos with step-by-step instructions for most of the tools and techniques used in the book. There's an FAQ with responses based on classroom experience, a complete toolkit for easy reference. There are a large number of practice problems and learning activities, as well as certification tips. Although the book provides a solid foundation for the Lean Six Sigma Green Belt certification, it's a textbook on quality, not a certification guide. Therefore, some of the advanced concepts that would not be taught in a traditional quality course are available only in the online student resources.
How is the book organized? The book includes 7 sections. In the first section, we present value-based healthcare and provide an overview of Lean Six Sigma in general. Then we follow with the DMAIC framework, define what is the process, measure where is the waste and how bad is it, analyze why is there waste in the process, improve how to eliminate the waste, and control how to keep waste at bay. We conclude with a section on getting the rewards for excellent quality and actually transitioning into the next phase, which is becoming a highly reliable organization. The content is very flexible and it lends itself to 3 different teaching and learning approaches. In the instructor resources, we have 3 different syllabi. One that emphasizes a qualitative approach with leadership, culture, ethics, and organizational dynamics. One that emphasizes a quantitative approach with tools and data analysis techniques. And a mixed approach that is the one that I use in the classroom, and it attempts to balance both the quantitative and the qualitative.
This book is all about quality and process improvement. We'd love to hear your feedback. What'd you like? What do we need to think about improving for a future edition? We hope this brings a ton of value to you. If you're a student, healthcare professional, professor, regardless of your role. We think you'll really enjoy the textbook and get a lot out of it. Thank you so much for the opportunity to let us share some details of our new book with you.